I'm calling the meeting to order at 9 o'clock, the Southern Berkshire Public Health Collaborative. And the agenda has as the first item of business, the nursing update. Bill?
All right, we're starting to have a huge list. We did obtain a per diem nurse, Stephanie Adler. She helped out at a bunch of our clinics to cover me when I'm on vacation or if I'm deathly ill and I'm not able to call anybody. So she'll be covering me next week while I'm away. She's gonna cover 3 blood pressure clinics, so that's great. And then Jim's advertised and we have a couple hopefully interviews coming up for somebody full time. Let's see. I have pre-booked flu vaccine for the 23-24 season. I pre-ordered 700 regular doses, but I think I'm gonna reduce that to 600. But I did order 450 of the high dose and 10 doses of the egg-free. Those are the same price as high dose. It's amazing how expensive they are. And then the Western Mass Public Health Nurse Association, I think that's what it is. We are monthly meeting, and there was 2 reps from Sanofi on our meeting, and so in the past, you couldn't return flu vaccine until it was expired. They moved that date up to May 1st. So it'll be nice to send back what we have and we'll get a 10% credit for this coming season. And the one rep I was talking to, he said, you know, if you're getting low, you have clinics coming up. If you order more during the season, it's like 1 to 2 day turnaround to get it shipped out. So I figure I'm going to order a lot less of the regular dose. We did receive our $75 incentive gift cards for the Get Boosted campaign through the state. And that's, people were pleasantly surprised when I was at Lennox Community Center on Wednesday and gave out $75 gift cards. They were ecstatic. They weren't expecting that. So I actually gave out 5 on Wednesday. What else? I'm gonna attend the Baby Palooza. It's a community baby shower up in North Adams on April 15th. Should have brought my dolls. I had little show and tell dolls for my car seats. So I got 2 of those. I had a nice banner made up so that way it'll attract, hopefully to get people signed up to either have a car seat inspection or maybe to give away some car seats. What else? I gave away 13 car seats in the month of January. I was happy about that.
Joe, while we're on car seats, if I can interject, I met yesterday with the chief of police at Sheffield. He has a community outreach officer. I'm trying to think of his name now. I can't. Who also is an installer, a certified installer, but they have no seat.
Okay.
They want to do a program, a community program in the spring. And I said, yes, so do you at some point. So you should expect a call from a police officer in Sheffield.
Okay.
They were very excited to know that you had resources.
Yes.
Good.
Yeah, so when the state grant opens up again, I'm gonna apply for those and get more of the state supplied car seats than the Buckle Up for Life ones. I have the same exact model car seat from the state and Buckle Up for Life, the Toyota program, and the Toyota ones are not as nice. And it's the same model number, same name and everything. It's just not the nicest material. So I'm working on getting rid of those.
Great. Good.
I have a question. When you do an inspection and you replace the seat, do you take the old seats and get rid of them?
I do.
Because that was one of the questions that I had from somebody, was that they didn't want to have to get rid of them.
I do. Yeah, put them right in the dumpster. Everything gets cut up and
Put in.
destroyed.
That's
Yeah,
great.
I destroy them.
Yeah.
Or recycle them.
Well, I knew they had to be destroyed. That's why I was curious, because
Yep, I get rid of them.
great.
You don't pour bleach on them?
Some of them could use some bleach. Like when the mother comes in high as a kite and whew, yeah, that's fun. Where you go to people's houses and they're high as kites. And you go in the car and I'm like, oh, how do you have your 2-year-old in there? But anyways, no past judgment, whatever. You do what you do. And then there's talk about, had a lot of phone calls from senior centers. their foot nurse is gonna retire in the next year. So we've been kind of having a discussion. Do I become certified? Do we try to find somebody? There aren't many foot nurses in the area. There is an online self-paced class that I could do, but then it's finding a preceptor, 'cause you have to do 4 hours of clinical time. And then how do we get paid? I don't know if you bill through insurance or if that's private pay, so those are things I have to look into to see.
Yes.
The Lennox Community Center now has a foot care person coming in for care of the Berkshires.
Yeah, okay, I'll reach out to them. I
Yeah.
talked to Beverly Dunn, who goes to Lee, and she goes to other towns, but I think it's the same nurse that covers Sheffield and Otis that were retiring in the
This is a new
year.
business, relative new business.
Yeah, they have pretty big business. It's like
Yeah,
everywhere.
it is,
Yeah.
Does it have to be an RN? Or is it
I think so.
Yeah,
I think so.
RN,
Yeah.
podiatrist, nurse practitioner, yeah.
They've done trained with my sister's roommate.
I used to work with her at Willowwood
Yeah.
when it was Willowwood, yeah.
So a couple of my thoughts with the staff on the foot care, so we're getting, we obviously, as we build the program, there's gonna be a lot of new ideas and new things we wanna roll out. But like, it's not about the training and getting Jill certified, but there's other things that I don't know enough about yet.
Mhm.
Is, like, what's the potential liability, for the town? We're not really set up to do out for reimbursements outside of like vaccines. We're not a doctor's office, right? And so like, to me, it's not more about getting reimbursed, because if we can get subsidies to provide the program, I think it's great to put it in our portfolio, but it may be easier to sub out, right? To make sure that if we have the money and the collaborative as we build up our coffers, is it worth just farming it out, just to make sure it's done? Because like, all I know is like my wife's dad, when he was on hospice, we had someone come in from the VNA, and it's a very skilled technique. And if you do something the wrong way with someone with diabetes, like, we don't need to be paying more in addition to what we're already paying for with malpractice, because Dr. Kenny covers that as our medical director, plus the town liability. I don't want to put us in a position where only a couple towns want a foot care thing. It's not like a core service per se under PHE, but like, I'm willing to learn more and figure out how to best make that happen.
Well, I have to say, anything do to reduce our administrative burden is something that has weight for me, because I think it's very easy to all of a sudden find yourself buried in administrative stuff, and if it can be handled, like, there you go. I think
Like
that's.
foot care of the Berkshires.
If you're a company that,
Yeah,
exactly,
right.
yeah, that's why I mentioned it to you, I mean.
No,
maybe
yeah,
you have
It
to
doesn't happen to
have
be
a
every
time to
month.
us.
We could set up like a 4 times a year or something as an additional service, but something we'll explore more on.
Anything further, Joe? No. Okay, DPH capacity assessment next steps. We know that we have a meeting next week at this. Is it on?
No, March.
So
Just scared me.
very briefly, I apologize. I just want to come out of the gate and apologize for all the confusion that's going on with the capacity. This is the mandatory meeting where we did have a rep for each town in the meeting, and so I got the email initially on Thursday. I was basically told these were the dates and the times that were available to us. So when Jane was out, so in quick response, we sort of settled in on the 10th.
Right.
Which was the day of the collaborative meeting, which is like, well, that's probably the easiest thing to do.
Right.
And then when I went in Friday, like, someone stole the date. And DPH didn't inform us that those were live dates and people were all competing on those days, so I was pretty upset. And
All right,
So
so
what
this
is
is
it?
it's the 17th, 10 a.m. fully virtual,
and I have it
February.
twice. on
March,
March.
March 17th. I sent a calendar invite, but I'll send a reminder. This will be fully virtual. We will have to post it as a collaborative meeting, but DPH is leading that charge, and then we'll see what happens.
Right, so, and that was one of my questions, was that I'd like to post it like early.
Oh, yeah,
So-
I can,
So do we write up our own post of it, or you?
there'll be a
You'll send
collaborative
it,
post,
okay.
we'll use DPH's
Great.
information.
I did forget something. I reached out to Otis, New Marlboro and Alford for blood pressure clinics. So I was looking on their websites. And so I went to Otis last month. Did I start? I don't know, it all blends together at this point. I have to say, that's my favorite town to go for blood pressure clinic, wellness clinic. And then I'm going to start going to New Marlboro this month on the 21st.
Okay.
Yeah, and then Alford, I think that's kind of up in the air for now because half the residents leave and are snowbirds, so we'll explore that some other point with the
Can I ask what you brought up the posting issue? Is it possible, Jane, without it being impossible or too difficult, to have a mailing list for things that have to be posted that includes our town clerks or whoever does the posting?
Yeah, so typically, I send it out to the collaborative members. We don't necessarily want every little piece posted in that. But so Jim follows up with a certain amount of clerks that he works directly with. And maybe what we could do is maybe expand that list to be all of the town clerks and just say, please post.
And that would be really,
Except that our town clerk doesn't post our.
I'll take care of that. So,
Okay.
so right now, I give it to the 3 towns in Great Barrington, 'cause it's in Great Barrington. So that covers us from open meeting law. It would be helpful if every town posted. It's kind of like what Berkshire Regional does when they send out their executive meetings. So I will figure out who the town clerks are for each town, and I'll do a group email, and I'll make sure that happens.
thank you very much. That will take, I always worry.
I think initially we were relying on the collaborative towns to do it, but we all have too much going on. I'll just direct email to the clerk.
That would be great. Thank
I
you.
have questions about that.
Sure.
Yeah, because our clerk doesn't post the board of health stuff, so that would come to me.
So I'll include.
Right,
so,
but, one of the things that I called you about, Jane, is the fact that I looked through to post minutes, but what I have in my emails are drafts.
That one.
Right, so I sent out
Yeah.
with the agenda packet, the approved meetings from 2 times ago. Okay, so
We're trying to set this up on our website. Our website is not our official posting. Our official posting is at town hall, and they've been going up at town hall, but we want to put them on the website. So,
do you guys want that as a separate? I'm sorry.
Can we have one conversation?
yeah, sorry, so I will need to have, you can just send me copies that are approved copies,
Yeah.
and then I'll.
Well, I sent it out to everybody.
Yeah, that's
As part
fine.
of the agenda packet.
Right, for recent ones, but not for the past ones, so we were trying to
Oh.
set it up so that, yeah.
Okay, so on there's a link to our, well, it ends up being Town of Lee, even though it has the SBPHC, and then when you click on it, it ends up Town of Lee. And I always put those, update
Okay.
that.
Great.
And so they're available, the approved minutes are available on that website. Oh, then the link is in the meeting notification that I sent out for this meeting.
All right, so then could I just post that link?
I'm not sure, you'd have to ask your town clerk.
That's what we're gonna do, is just post the link for the minutes, anybody
Just
that
post
wants
the link
to.
for the minutes, right?
Yeah, and if they wanna read the minutes, they can click the link and go in.
All right, so is there a way that we could do both the minutes and the meetings? And then just have that as a post and then say,
Well,
if anybody, that somebody coming to the Board of Health, all right, or coming to our website, if they want to use the website. They
so
can do a link.
if your official posting is your website, I think that's where, I'm not sure if that suffices. If you want it for informational and supplemental to whatever your official posting site is, then yeah, just have the link, which
Yeah,
it
that's
stays the
what I'm
same from
thinking.
month to month. It's basically just a document that it will have the dates and like agenda, meeting minutes, all the way from the beginning of our collaborative. And that link stays the same.
That would be, I think that's a much better solution for us, because then when I get the minutes or the agenda, I can post the agenda on the town hall bulletin board.
Yeah.
Because our bulletin board just gets too full. I can't be putting minutes and stuff up too.
Okay,
So,
good.
great, thank you very much. That's very
So,
helpful.
anything more on the capacity now that we've nailed down the date?
No, it's just.
So does this letter go into every town?
No, it's very quickly, I've already sent emails out to the 4 towns it's affected. This is, Great Barrington, we talked about this, Great Barrington, Sheffield, New Marlboro, and who am I missing? Mount Washington, because like BRPC and us applied
Right.
and they were listed twice, so for clarity purposes, they're just asking to get, you know, the town manager, select board, and community 2 signatures.
Right.
So that way there is commitment, because like I know it's a pain in the neck. Believe me, I thought it was a matter of an email sending out. But like, I know it's a pain in the neck, and I wish we didn't have to have town managers and select board sign off on things. But I also think about like this is like real money coming into our towns. And I just think the state just wants to ensure that there's no confusion and whatnot, and the sooner you can navigate it, the sooner I'll get it from the state.
Do it next week. Any other issues with that?
It's not an issue, but, I think, so we're gonna have it on the 17th. I think we are gonna need to decide how quickly we turn around and whether we wanna have a full meeting to process what has been presented to us and what our next steps are. So I don't know if we wanna wait till our April meeting or if we wanna have a meeting in the interim.
Well, it's the 17th, it would be like 3 weeks. If we could get one earlier, I suppose.
Here's what I'll do, when we post the agenda for the special meeting. I'll put a couple extra agenda items in there that will give us an option to select a meeting, which we may or may not decide on. We do that.
Okay, great. Sharps update.
Oh, so we've had some progress. All those sharp containers are in place. And, because. Where's my folder?
I thought you put it back in the box.
No, I put it underneath.
Is it this?
Yes. Thank you, Ellie.
You're welcome. It's a miracle for me to find something.
Yeah. So, all of them are in place, the signage is for you, Rebecca, if you choose to accept it. So, we have a little sign for now, to go on the side, like about what's allowed, what's not allowed. And then this goes on the front. And it actually looks really nice. I know it looks really hokey right now, but, so we have a sign to go on the front. It says yes, yes, and then it says okay. On the other, because people, that's how a lot of people are collecting their sharps right now. So we need an active campaign for sharps, and there's some already for like, because FDA has a lot of like public service announcements to go to the radio, like, you know, there's lots of people that have lots of sharps, and this is how you get rid of them. So we're gonna craft that and just get that word out. We have 3 different sizes of sharps. And they are labeled with the different locations around town that, around the county. And then we have bigger ones here too. So it's just gonna be a matter of pushing these out. You know, we have some great community partners. We have, the harm reduction van is providing us with a lot of containers. Great Barrington's a great partner and is gonna be purchasing containers. So, it's just gonna be with the individual towns to find out, like, first of all, we still are missing a sign that is just educational to go at, for instance, the transfer stations and town hall. Places that these things aren't, the kiosks aren't, to say, hey, you can't, like, here's how you get rid of your sharps. And I think it's just gonna kind of be a gradual process. But it's exciting. Rebecca, I mean, this is something that has taken up brain space for 8 years. And it's finally kind of coming to fruition. So, kind of be on the lookout for that. I have APHC, the volunteer corps, working on poster. Because while I can do like simple stuff that's like informational, it's outside of my scope, I feel like, to come up with something that looks professional and that people will be like, that's definitely real.
Right, yeah, and we've got that resource, we should use it, that's
Mhm.
no reason not.
Yeah.
We shouldn't have to.
Would these be just for contaminated sharks?
Anything sharp, so land flips, like any,
People will be getting rid of a lot of old stuff that aren't contaminated.
well, if they're expired, we would still want them to get out of the waste stream, and I think that's part of our education is, you know, at landfills, you know, like recycling facilities, even just working on a garbage truck, there's a lot of needle sticks that happen because people will put, their needles in there and not realize, you know, a lot of people are right now still curving their needles around. They're exposed, that's an infection, a potential infection, that's a risky behavior for them, and it's not gonna prevent someone from getting stuck through a thin plastic bag. And so I think, right now, I feel like the resources are there and, that if we end up getting a huge amount of these things, that we'll call it a win, even if it's
Yeah.
unloading.
We've taken some expired stuff, right, unused, we already got rid of them.
It seems to me, if I'm understanding the objective here, I can imagine having a bunch of these reddish things, not the pink ones, but hand out at the senior center, people who are diabetics or whatever, and then have them bring it back into. Does one dump that into a different container?
Well, Jill, no, once it
Okay.
goes in there, it stays in there. Jill, do you wanna explain kind of what your thoughts are about what, at the senior center?
Yeah, so my thought is if we make up a flyer and advertise the day that I'm there for blood pressure clinic, they can bring in their sharps in an appropriate container and they will be given new ones.
Right,
And then it goes on and it gets locked, so. Once the needle's in there, that's some of the education is like never stick your hand or try to mess around it.
good, okay, I have no experience with it, so I appreciate it.
So I had I received a sample from a company that it's a very small unit, it's only about this big, that you stick your syringe in and break the needle off.
A needle clipper?
The needle clipper, and maybe that's something that we can look into, also handing out to people. To have the needle clippers go along with these containers, because many of the newer medications now are self. Well,
They're
yeah, and they're-
retractable.
yeah, right, they're retractable, and they, once it's been used, it goes
Like
back.
an
into-
EpiPen.
Right,
Yeah.
like an EpiPen. So these containers are great for that, but for the people who are still using a separate syringe to actually draw out their dosages, that clipper thing might be, I'll get you the cop from the company.
That'd be great, thank you, Ellen.
Because they wanted us to try them. And I tried giving them out to everybody and everybody said, oh no, mine's are retractable. So I have like 5 of them. But that might be really useful for people.
Yeah, and I encountered something that totally confused me at the emergency department at Fairview. For something that all worked out fine, but the woman had injected my husband with something. And then she threw the needle, where did she throw it? But she didn't put it in a sharps container, and I said to her, and she said, oh, it's plastic. It doesn't have to go in the sharps.
Oh,
container."
Yes.
Yes,
Yes,
yeah, I know what she's talking about.
Yeah.
Oh,
yes, they have needleless, they're needleless syringes.
needle.
Yeah,
How do they insert?
Because when you go through the
Like a
IV,
catheter,
you don't want to use a needle, I don't know how to explain it, but yes,
Oh, okay.
Yes.
It's a
They go
catheter
through the port.
that fits
Yeah.
through,
yeah,
Oh,
Yeah.
so that they're not actually injecting that
Oh,
particular thing into the
into
vein.
your, I see.
yes,
Okay,
yeah.
okay.
It goes in through a port.
But it's good that you're questioning that. I
Yeah.
remember when my kids would get
Yeah.
vaccinations, the older cell nurses would stick the needle into the padded, you know, and that's how they used to do it.
Yeah.
And I was like, that seems really unsanitary. I'm no public health official, but that seems really unsanitary.
Right,
I've
okay.
got some
great.
experience with these. In order for them not to fill up too fast, people should be instructed not to put the syringes in, just not
No.
not the whole.
We want the
just
syringe
the
in there, because we don't want the syringes to be out in the general public.
needle.
Because actually, it's a solid waste law under DEP that you can't put any of that material in the solid waste stream. So it's not only for a safety perspective, but it's to prevent, the solid waste.
So they need a bigger.
People,
And that's why these containers are tough, because they'll fill up pretty quickly.
We got the resources now, we're kind of set up in a way where like, it doesn't matter, like, it's.
It's only $75, like, it's a pretty big container, it's like a 20-gallon or.
It's like a trash barrel.
Yeah, and it's $75, and I think we're gonna have a lot at the very beginning. Especially if people do have Tide bottles that are, like.
You mean the station, not the actual, not this container. I think his point was that this container, this container is actually kind of small for people to take home. If
Oh,
they're putting the whole syringe. and stuff.
yeah, and then we have one more side, which is a 5-quart. That there's like a stash in one of the towns that I'm gonna see if
You
they'll
can't
trade me
free-
their stash, because.
Can't liberate them.
I have a few things, so. I ordered a bunch of those containers, but can I get the template for the label? Good news, bad news, something we've been dealing with for a decade, so the container was ready to go to the senior center. We got there and the senior center said, no, this is not what we had in mind, so. Out of just desperation, it's just gonna go in the health department and everybody's gonna have to get over it. So that being said, I know I promised you those containers, but I think I'd like to keep them back. Just to kind of mock that program of if somebody brings them in, I'd like to replace them, and I don't know, maybe we should find some grant opportunities, because they were quite expensive. I spent $500 and I didn't get that many for $500, so. Like I said,
I
I
think-
think to keep some back for a little while, and then if I turn out to have surplus, you guys can have them.
Well, and I think the bigger issue is that we've got to recall all the stickers now,
Oh,
because it says Claritique Senior Center. But I haven't really handed out that many, so,
Yeah, so it just put health department, obviously, the town hall's only open 8:30 to 4. And then this is nothing new, but the concern has always been, what if somebody leaves loose needles? And I keep preaching this naive optimism that really hasn't been a reality. Has that been your case with Alfred Transfer Station and where the Sharps kiosks now? I don't really.
Yeah,
It's happened in our transfer station, that's why we won't do it.
Okay, but you don't have a kiosk there. I'm talking.
so my
about-
thoughts back there, like years ago, I was against that at Tri-Town for a lot. This came up many, many years ago, because I was fearful of that.
Mhm.
Because people just randomly walked in our door.
Yeah.
It's late at the end of the day, and they leave a plastic bag
That's
out.
what Mark-
So when Jane finally convinced the Tri-Town board, since this is a great program, not that they didn't say they were. We decided to put our kiosk inside versus outdoors. So it's more of a controlled environment. So when people come in, they actually come to they don't just come in and just drop it off. Most people so far have come into the office and, hey, can I drop off some Sharps?
Yeah.
And Joe, Jane, the other guys would be like, okay, it's in a good container, throw it in here. I have not seen any loose needles, but Jill has a thing where you can put individual ones into another Sharps
wall
container, it's on the wall.
Yeah.
So that'll be an option, so people don't just drop them.
It's just always the threat that, okay, we'll try it, and then if somebody acts negligently, then we have to pull the container. And I think maybe we don't have to have this conversation now, but I think I'd like to get ahead of that, because maybe it is inevitable, and if we as a group decide on a policy, if that were to happen, I mean, there is a bio-waste cleanup or biohazard cleanup kit in the kiosks that we have. But I mean, it would just really suck if we put all this effort into finding viable locations and then one incident happens and then in the town,
Everybody
or
gets free.
the operator says, no, we have to nix it. So maybe on a future meeting or in a subcommittee, we can like think of a protocol, or if this were to happen.
Well, here's the thing too, is that it's not just a bag that's in there, it's actually a thick plastic thing that's in there, so realistically, if someone did put a needle in there, it's this thing.
If somebody just
Drops it on the
back
front
of
of the plastic bag.
Like, and left them outside our door because they know there's a kiosk inside.
Mhm.
That's the,
Well, and that is a hard part of, I mean, if you're, so, yeah, we can talk about it.
okay.
Well, I have a question. I know that the hospitals, the reason that the hospitals didn't do it, which for me was the logical place to bring your syringes, was that they said that they didn't want to take on the cost of disposing. Would they possibly be open to having the kiosk in their lobby so that people could drop them off, and then it's a contained unit? The hospital doesn't have to take up, they don't have to own it, they don't have to dispose of it. But even if it was on the inside of the emergency room doors, which are open 24/7.
Which there is one there, by the way. It's-
Oh,
There is a Sharps at Fairview, but they just now allowed us to start advertising it.
oh,
last-
okay,
like
because
2 weeks ago.
they were very resistant to that before, but I'm just thinking of that and the other areas would be any, well, we don't have any down south here, but you know,
Probably
you're
Eastern
talking
Master
about
Medical.
places.
Yeah.
The Eastern Master.
Eastern, yeah, Eastern, yeah. East
Well, I
Mountain.
wonder what, Vim has got its own, but I don't know what it does for the public, for its patients. I'll
Well,
find
then,
out.
right,
Yeah.
but that would be another site, you know,
Yeah.
the lobby of them, or the lobby of East Mountain Medical.
Yeah.
They're not owning that, the expense of having to dispose of it, because it all
Right.
comes under the program, but that is an accessibility
Right,
thing,
okay.
yeah, okay, that's great.
All right, anything further on that? New business, 2023 priorities and goals.
Looking in your agenda. That, you'll see, a printout. I could print my copy out on the computer if we didn't have to. And so what this is just, there's a couple of things of information on here. One is the area of need, and that kind of, that general, topic fits with what the state is telling us, our core functions from the Board of Health. So that, and then, so the topic, like first one's disease control, TB management, is it a core service that we're required to provide? Yes. So Jill and I sat down and we came up what we think our priority is. Okay, so that's a high priority. It's required, it's needed. And then the comments from that is, you know, we'll follow up with the, oh, that's what kind of a description of what that is. And so what we're gonna ask the towns to do as we kind of go through, we can talk about it today, or you can talk about with your town. Is what is it that you guys prioritize? And, when it comes to, first of all, obviously the public health nursing program, but then also, as we kind of look at expanding, it's gonna, and we have our meeting with the state, it's gonna inform our next steps and what we feel that we need, as communities, and where we'd really like to go in the next, 3 years or whatnot, so.
I actually like when they put the core for local board of health in there as a yes or a no.
Yep.
Because I know we briefly talked about, because you have all this PHE money,
See,
and potential
we went
capacity
through
dollars, but it's gotta be for core program, but what DPH describes as core functions of public health. There's these other non-things that we will discuss that may not be like, like we get a big robust of vaccine dollars in, right? That's not. DPH doesn't dictate that, the collaborative will dictate that. So I'm really glad that you were able to put that in there, because unless you dive deep into those things, like some people may not know if it's a core function or not. So that helps clarify that, yes, this is a core function that DPH is saying.
So just to clarify then, where it is a core for the local board of health, the action, but the comments, the actions that are described in the comments are those to be taken on behalf or at the responsibility of the collaborative? Or do they come back to the local? What?
I think Jill and Jane just put some comments in there just to explain like what the function is.
Yeah, it's to give the boards the idea of what the state is expecting
Yeah.
as a responsibility, a core responsibility.
Okay.
Right? I mean,
Right, and so, and there's kind of, and you know, we're gonna have money. There's basically three streams of money that are kind of feeding the collaborative, right? We have what we collect from the towns, which I just looked, and I don't know if maybe I had a different. But actually, the vaccination program, the administration and making sure actually is a core program. So I'm wrong on that. But so there's the money that's brought in from the towns. There is the money coming in from the Public Health Excellence Grant. And then the third thing is gonna be the money that comes back to us for the vaccine administration money.
Right.
So the first two of those monies pots are intended to be core functions. The areas that we can do some of the projects that we feel are important to us, but aren't legislatively mandated by the state. That's where we'll have resources to like, oh, a car seat program, we would like to continue to support that. And maybe we buy.
Prescription drug collection, things like that.
Right. I'm just trying to sort out who has to do something when I take this to the board and they say, okay, yes, we agree, TB management is a high priority, but it's a core for the local board of health. I can't do that. My board can't do that.
No,
no,
this
just-
is what we're gonna do for the public health, for Southern Berkshire Public Health Collaborative. And I can make that clearer at the top,
Okay.
that, you know, what the SBP HC can do to,
Say the collaborative.
the collaborative can do to build that function.
Right, okay.
It's really just, I think it's meant for feedback, you know,
Right.
like you give us your ideas and opinions on what you would like to see for the collaborative in your town.
Right. Not that suddenly this is something that.
And again, this may change. This was something we put together like a year ago. We
Right.
started thinking about, it. We had a work plan, if you remember, then we had like this, and then we're not sure what the state's gonna say about the capacity. They're gonna give us
Right.
recommendations,
Right.
whatever that means.
right.
So this could.
See, we
change.
went through a lot of this already,
Yeah.
but you know, that the board,
Yeah,
yeah,
okay.
but in general discussions, I mean, that's the other thing that I had a question on, is this something that you're gonna want the board to vote on? Because if that's, then that elevates it into, you know, a little bit more problematic areas.
Well, I mean, how do we get feedback? I don't think that we want even a vote from the boards, because we're not, like, this is
Right,
the
well,
governing body.
we're just happy to say, yeah, we think this is a good idea, but then if it came to them saying, well, we're gonna vote for this, then and
No.
appropriately, they were like, well, we're gonna need a lot more information, we're gonna need
Right.
this, and so what I saw happening was that it was getting bogged down.
It's really just trying to
feedback,
get feedback and input from the community, other than just the people that are sitting here, although I think your guys' feedback is really important, but we want to give you a tool to
Sure.
inform your understanding of what your community
Right.
needs.
So ideally, it's really to solicit feedback between the representative, bring it back to your boards, get some feedback. And like I would envision down the road that we hone in on what kind of priorities, you know, we wanna, this governing board wants to accomplish in our
Right,
communities. It's
right,
really just a
right.
tool for
Yeah,
now, not
yeah,
nothing.
this is just a laundry list in a
So-
sense.
Do we have a link? What I'd like to do is I'd like to send this out to my board electronically and say, think about it, send it back. You know, it doesn't have to actually have to be at a meeting. This is for you to tell us what you think.
One of the things that I thought of doing is, it's not gonna take that long to do a Survey Monkey. And it would just list all of these things and say, rate high, medium, low. And that,
Yeah, I'd like, well, for us, I can see that, but for the board, I'd like to have a discussion and not just put it to them cold.
okay.
Well,
Yeah,
yeah,
I'm happy to clean this up just a little bit to make it easy for you guys to share with your communities. And then it would be great to get some feedback from not just the boards of health, but also what a council on aging, what they're really like, something that's not being provided right now that they would like to see.
Well, I'd like this to go out. I would like a link for this to be able to go out on my website, on the town website, with, under the Board of Health stuff and say, you know, we're literally doing a survey to see what you think you would like to see your town work on. And then have them get it back to the Board of Health. Then you see, then the committee has had some community input into it. I realize, I know, I get the smile, but where we are in our town right now is in a very aggressive position, and I think that this would be very helpful for people to say, look, we really are asking you to do some input, but if you're gonna do input, you gotta read it and you gotta answer it.
As long as it can be clear that it's what the collaborative can do to assist the towns and not what
Yes,
they want the Board of
absolutely.
Health to be
Right.
doing.
Right.
I think that
Well,
that's fair.
except that, yeah, the problem, yeah, I see the problem because.
Because the boards will always maintain their autonomy, right?
Yeah, that's in our bylaw.
We did a
And state
community
law.
survey
Yeah,
recently
yeah.
just for our town space. I'll never do one again. Like, it's a joke,
Interesting.
the things coming in, like, it's disappointing. You get good feedback and then you get people just being.
Well,
silly.
yeah, and that's kind of where.
At the
yeah.
end of the day, towns can do whatever they want. The agenda, the file was sent out with all the agenda packets. If the town wants to put that on the website, have at it, download the file and do your own link. I think it's a little dangerous
Right.
early
okay.
on, because the general public, they won't know what that is,
Mm.
right? So,
See, I'd be afraid in our town, you're gonna find people going, maybe not to real issues, but let me tell you about my cell tower issues, let me tell you about.
Yeah, right.
PC
Well,
issues,
yes,
Because
yes.
that seems to be all you hear around by us, never mind that you're doing COVID or other things. I could just see this being a box of firm that opens up and just, they're already angry.
Right, well, that's a good point. I guess what I'm reacting to is that what our board is finding is exactly what you're saying, is that everything is like, in order for the board to come up with what they think the collaborative can help us with, we need to have some input from the community as to what their priorities are. That's the part that's sticking for me. It's great for the board, you know, I could send this out to the 3 board members and say, give me your feedback. And I can guarantee you that 2 out of the 3 are gonna say, we have no idea because we haven't talked to anybody.
Would it be easier
So
if
how
we're
would we
just
manage that?
asking our boards, yes, maybe to brainstorm a little bit, but high is high, you know, that I don't think that really. We can't.
Yeah, do we
I
have
don't
to
think
do
we
high,
can-
medium, and low? Can we do yes, no?
Well, I think what boards can weigh in on is rating, what's labeled here as medium and low. Like, do we want to move something that's low
Mhm.
up to high? Do we want to move something that's medium down to low? Like, I think that's where our
Oh,
wiggle room
good
is,
point.
as opposed to asking for the moon. And then, like Pat said, we can't really rearrange what's labeled as high, because that is what the state is saying is our priority. So maybe that's kind of narrow it down a little bit. Or is that making it more complicated?
That's a good idea.
No, I think that's a good
actually.
idea. And the only thing is like some of the things that, like, we, or I hit listed as high, like the disposal of unused and expired medication. That's not a core function, but I feel like it's, you know, for me, I'm like, that's a high priority. We need to help the towns and the police departments. But there are a couple of those, but yes, if it's high priority and it's.
Can you ask what's like high as a core function, or what is a core function in here, and then just say to boards of health, everything else is fair game to weigh in on.
Instead of having it just be yes or no as a core, like make it a different color or something.
You have somebody in the waiting room.
one idea, Rebecca,
Mike, you go.
I think, what we could do is like, maybe they can fix the priorities, put all the yeses right there, actual core functions, and then lock those cells so they can't be modified. And just put, put an asterisk and say, these are mandatory PHE core functions, whatever by the state.
Good, yeah.
And they can then rank the other ones
That's, yeah, that's.
See if we could do that.
So your point would be like the substance misuse. They have normalizing Narcan campaign, medium, and if our board felt that that was something that we'd like to move up to high, then it's, okay, that's very helpful.
And
That's very
then
helpful.
the other thing is like lead exposure. So, and Jim knows more about this than I do, because I think he was around when this happened, where the state lead protection program just dumped it on the boards of health.
Yep.
And it's a very weird situation, because like I know I've taken the training twice.
Yeah.
But never have they been able to have the mechanism to have you do your field experience. Also, it's putting a pretty big burden on the boards of health, but it is a core function.
Well, I think we need to move on, but I think the issue here is, let's try and understand the communities and the board's priority, and then figure out what we can do. Yes, should it really, is it an onerous thing? Should we find a way that doesn't actually dump it on our lap? Should we contract? Should we? So let's not worry about the mechanisms, I think, at this point, but just get the priority.
But I will massage that to make it clearer and easier for you guys to use as a tool, and you can use it however you want.
That's great, thank you.
That's great.
Review draft articles of organization. I actually went over them yesterday, this morning. I've got a bunch of course, my usual editorial things, but there are also some issues that I'm confused about, and I wonder what they actually mean and what I mean. I wonder if this is the place to do that in the committee, the whole group, or if we should. I mean, I'm happy to sit with you, for instance, and go through this and maybe help clarify some things and then send it out again.
Sure, we can do that. I think, well, maybe, so this is something we've been working on, it's not a requirement, but it's sort of like our cliff notes on how we function, rather than looking at the agreement stuff. But we could, if people want to make edits and changes, you can get them to me and I can try to fix all
Yeah,
that
we're
and get a whole list together.
Know what's confusing to you, that what needs clarification.
I think that's what we're trying to do initially, is get feedback.
Great, okay. So let's try and take that on as an individual responsibility and get that to Jim in the next 2 weeks. So he has something to work with prior to our next meeting. That's great, thank you. Subcommittee report, sustainability. Thank you very much, subcommittee on sustainability. I really appreciate the work that you did. I think we all do. Lovely little one pager here. Are there any things to discuss in that people would like to bring up?
I think the only thing thanks for everyone to meet, and I did, we talked about, trying to understand like the PHE resources and stuff. And what I did do is after our meeting, I did go back. I think it's in our notes. I've given everyone the expenses.
Right.
These are the PHE expenses through the second quarter.
Mhm.
And then I also went back and looked at, the money collected for the contract, what we're spending, what's available, and so on and so forth, as a good starting point for a report. And as we build up, we'll move that along. So like right now, so I'm on this sheet right here. We went back and, the contract dollars is a little bit different compared to the previous fiscal year, because we took on new towns. And so it's a pretty healthy budget number for now. 61,000. We have to take in consideration too, that we may have more vaccine reimbursements coming in, which will give us more money. But then we also have to pay out the pre-order of the vaccine. So we're always a year behind, right? So as we collect FY23 contracts, we're using that dollars to pre-order for the following fiscal year, and it just keeps going. So, but I do anticipate, even with we had to buy laptops, for example, last year. That's not a cost that we're going to incur every year. We'll have to hire Kirby and nurse with supplies. So I think we're on a really good path of sustainability, at least with respect to the vaccine program. I hope that we get a lot more vaccine reimbursement. That's going to give us a lot more money to play with. And
Well, how
so
much do we have a sense, not to get too detailed, but do we have a sense of how much is still outstanding, the possibility of
it's-
what might come in?
it's really confusing, to be honest with you. So we got 32,000, I just got an email, Jane, that we may got another deposit from Medicare fee, which was like 2,800. So I think after we get through the first cycle, I think we're gonna really understand like how it all works, because there's different like reimbursement levels for everything we do differently, like Jill is
Right,
a
the
reimbursement for a
state,
homebound, and there's
yeah.
private purchase reimbursement,
Right,
there's this, there's
right.
that, there's Medicare, there's Mass
But-
Health.
But if you just said we gave out 749 vaccines and we've collected in one pot or another money from 342.
I think that what happens, Pat, is it depends on what volunteers we have. It depends on how well people fill out the insurance information. It depends on whether people gave us. So there's just a lot of, so we don't have and when we get the money, it doesn't say this is for these dates inclusive. And so we
Right.
don't know how much like this amount is, how many people are represented for that.
No.
And so that's why I feel like we're gonna just have to get a sense of it year
Right,
through year.
right.
And at some point at the end, we'll be like, you know, we know we gave this many shots and this is what the maximum amount we could have gotten.
Right.
This is what we ended up getting, so let's assume we're gonna get 70% of what we think we're going to every year.
Right.
That would inform our estimate for next year, but we just don't have the information yet.
What a way to run a business.
Oh, my God. Well, me personally, my baseline is like, just give us what we pay for the vaccines, that'll keep us going, but I
Right.
think we're gonna get more than that.
Okay, thank you. Any other comments on either the report or the quarterly expense report?
It was a good meeting.
Great, and you've got another one scheduled. Good, good. Okay. Opioid settlement subcommittee.
I mean, I don't have much to say other than, rural recovery, we had initially met as a group, but rural recovery is really taking the lead on all this stuff. They put together their white paper per se, we work closely with making edits on that. And so what I did with my stuff is we presented to the Lennox board, they sort of endorsed the notion of trying to pool the resources, and we sent a recommendation letter to the select board, which then rural recovery will take on. You know, if there's questions and answers, we would go to support. But there's a lot of work that needs to seem to be happening, but that's not the Board of Health for them to sort that out. We sent off the support letter, we sent off the rural recovery white paper, we sent off all the warrant articles, and I know it came up at Monterey. We're gonna do the same thing with all these other towns, and the Board of Health role is to be supportive if they so choose to. And so I did send out the Lennox letter, if you guys wanted to, you know, modify that if and when you get to that point. And then just let Gary and Nanda know, you know, what they can do. I just kind of said to everyone, like, look you have questions at the select board meeting, you should reach out to them directly. So it's sort of like supportive, kind of like punting it off to them.
And the one thing that we're still trying to get clarification on, and I see Mike, that Mike Hugo's here. Hi, Mike. Everyone can see you this time because we have a different setup. Everyone say hi to Mike.
Cool.
Hi, Mike. 20th century.
Yes, and so, and it was Great Barrington that, was asking, and this is, I'm looking at you, Mike, where are you? I'm looking at you, Mike. There was a question on whether or not I needed to be certified for free cash before it would be available to be spent. Because the money that they get for this fiscal year, then like it closes June 30th, but usually free cash isn't until later on. So it's confusing because I think that we need it to be either spent or put into a special revenue fund this year. But if we can't put it anywhere till it's certified as free cash, so there's still some ambiguity around it. And so we're hoping to be able to get those answers so that when we go to the towns that we definitely know that that we're being helpful. What are your thoughts on that? Now I'm looking at you for real.
Okay, so my thoughts are that MAHB is actually, I am trying to get something up on our webpage. It might already be there, but we have a series of warrants and
Yeah, it is up there.
ordinances. We have an opinion letter that was written by Cheryl, talking about exactly how that all flows out. Yes, you have. Okay, good. All right. So you have everything, you have all of our thoughts right there. If you have a specific question like that, I have stayed away from that because I'm working on so many other issues right now. And that's one that requires a lot of attention at the moment. So if you want to reach out to Cheryl, if you have a specific question, she can get you a very quick answer. But today's crisis, of course, and I'm interested in hearing what you guys are doing on this also, is that I'm writing an amicus brief right now for us for the cell tower issue up in the north part of your county. So I was wondering whether are you guys filing something? I heard, Jim, that you were going to file something in that
I
case.
did that privately, Mike.
Okay.
I
So
did that as a citizen.
okay,
So
we'll deal with that.
It's
I'll talk to you later about that.
it's not
But
tri-town.
we're filing one on behalf of the boards of health,
Nice.
trying to delineate what how the boards of selectmen, mayors, councils, and town managers can't tell you what to do. And so that I'm kind of buried in that. I want to get it filed today. So that's why I was late right now. But take that question directly to Cheryl. She'll get you an answer.
I think she more or less answered it.
Thank you, Mike.
Yesterday.
Okay.
Right.
Anything else on the opioid subcommittee?
Yeah, I think Mount Washington sent a letter to and the board thing to the select board, it goes to the finance committee, and
Good, okay.
I will send out the MAHB stuff though to the what we're finding is that the place to put this is with the finance committees. Because they're the ones who have to understand kind of what, in all fairness, to the process of why they're going, in our case, for $12. Why they're going through this. That was very helpful, Mike, and it is up on the website, so.
And department, actually, Great Barrington's accountant, we were talking with her this morning, and she's gonna reach out to DOR.
So what's your question, like when free cash closes to when you can spend it? Is
Yeah,
that-
or
So like we just closed, we're a little late because we had a software conversion a couple of years ago. So your FY 22 closes out, you get your free cash certified, ours just got certified from FY 22. That's what you're voting to spend in FY 24. So when we close 23, that'll be what we vote to spend in 25.
But
So-
go ahead.
Yeah, so that's usually the timeline.
The impasse is that the accountant and the town manager are saying we can't vote to appropriate that until that free cash closure.
Until it's certified.
So that means we're not going to town meeting in May, we're going to town meeting in May 2024 to make this appropriation.
Oh,
But it's conflicting with everything MAHB is saying. They're pretty consistent that we do this now as opposed to next year. But DOR, accountant, town manager, and their good understanding of municipal finance is saying the opposite. So it's very confusing.
yeah.
the way that it was given to us, just in general, like to be a settlement and not have it be able to be spent like a grant or something like that, just makes it really messy.
Yeah, because like our opioid funds are coming in FY 23, so that won't get certified
So next year.
a year from now for me.
Yeah.
Something I would spend in 25.
Right.
Okay.
I hope the recovery center can hang on that long.
My head, that's the issue is that their funding is done by 2024. Okay, this year, 2023, because it was only a 3-year HRSA grant, as we all read in the one page. So I don't know how desperate they are, but I think they're really counting on this. So.
But
hopefully-
you can vote to spend your free cash on whatever you want, like if we want to buy a truck or a wood chipper, so I don't know why we have to wait for that.
Right, you can
Yeah.
have existing
We
free
could
cash
vote
money that
pay
you can put in.
It out of free cash, even though
So you
I
can
see.
vote, so say Otis has portion X, you can actually vote now for FY 24 to give them
Yeah,
a
like,
portion of your existing certified free cash until you
To
can pick
whatever
up the
you
process to the following.
Right.
year.
yeah, but it's, and then it goes to town meeting,
Yeah, yeah,
each
yeah.
vote, like,
Yeah,
so we could have an article for rural recovery, even though we
Right.
don't receive any opioid.
Right, and then then you just repay that when you actually are able to get that into free
Can I-
cash.
Can I just ask, would you like me to get Cheryl to chime in right now? She's available if I want
I
to.
feel bad because we've asked her this question 3 times and she's answered it 3 times the same way, so I don't want, I mean, we would love to hear directly from Cheryl, but don't want to frustrate her by asking her the same.
I
question.
think that it might be good for everybody at once to, so let me send her your link.
She's pretty she's pretty unflappable and unfrustratable.
Okay.
Just remarkable about that. What do you think, Pat? Should we have her pop in real quick?
I'm not sure that it's gonna be useful, but I'm only one person. Yes or no? Raise your hand if you want to have Cheryl involved.
sure. I don't care.
Why not? If she's
3,
available.
okay, well, yes, please, Mike.
Madam Chair, if you don't
Okay.
mind, if we're waiting, is there if I introduce Ivy and Tom to the
Please,
group? I should have did that at the
yes,
beginning. So Tom is on the Monterey Board of Health. He's our delegate for Monterey, so I want to welcome Tom.
Thank you.
We also have Ivy Goodwin, who's our new Tri-Town mental health clinician, serving the 3 towns. So
Oh, wow,
we stole her from another organization.
lucky you.
She's trying to meet today.
Steal her. You did not steal
We
her.
borrowed.
She applied for the position and she accepted.
So she's on her 2nd week, she's still hanging on, and so that's a new program that the 3 towns got together with the police departments. And really work on, de-escalation issues and mental health calls, but we're helping Ivy with some of the community side stuff, helping with housing inspection when we had mental health issues and working with the schools. And
Oh,
so while it's really a tri-town program right now, there's a lot of opportunity to expand South County, because this is a serious need that there's way too many gaps, in my opinion. So thanks for enduring our meeting, Ivy.
No problem, thank you.
Steve from Sainsfield.
And
Okay, so
can
she's
I
on her
look a
way
little bit
in.
like Rebecca today? Anyone else freaking out about
So
that?
she's waiting. I think he said she's waiting.
Oh, yeah, not quite yet.
Okay.
I'm ready for her.
Okay, is she,
Oh,
I don't know
there
if
she
she's in,
is.
okay,
There
good.
we are.
Hi, Cheryl.
Okay, I'll look back.
Hey,
Bless you for coming again.
sure.
They didn't want to, they
Go
didn't want to frustrate you with the same questions over and over,
Okay,
Cheryl, but I
let
said,
me,
you're patient.
before we go ahead, let me see if I can did you send the link to Rich?
I will right now.
Okay, and let me email him and see if he can join, and let me pull out. Oh, I think I have it here.
And the real question, like the overarching question, right, is can we appropriate the money before it's been certified as free cash for funds that were received in fiscal year 23?
Yeah, I think that you have to vote to appropriate it. Otherwise, it's not going to be dedicated to opioid work. It'll be free cash that'll go into the general fund, but the legislative body wouldn't have voted to have it go to opioid use. Now, that doesn't mean that the towns couldn't use it for that, but it would end up as just general fund money.
So the warrant article example, it says, see if like Agawam will vote to appropriate a sum of money from the fiscal year 23 when certified as free cash to be expended.
Right.
So they would be able to vote for it, and once it was certified as free cash, then that would free that up to be used.
Exactly. The problem is if you don't vote to appropriate it, then it doesn't have to be, it would just go into the tax levy, because it wouldn't be singled out. It would, just like when you issue tickets and you get, and the clerk collects the money, it goes into the general fund. That the money would just go into the general fund. And because, and then the money that was supposed to go to opioid use now would just be part, it would just go into the income for the town, the general income for the town. So it could only be used to, it would reduce your tax levy because you're getting more money in, but it wouldn't be legally dedicated to the opioid settlement.
But
Does
they,
that
but
make-
this money really, but this money has to be spent for opioid settlement.
Correct. That's what the law says, it has to be spent for that. So what, and the challenge has been that the money came into the municipalities before anything was set up, before there was a separate stabilization fund, or before there was a way to capture the money. So let me, it came in a strange way, for municipalities, not a strange way. The money didn't come in through a grant from the Department of Public Health that would have gone directly to, that could have been used directly for opioid work, because that's what the contract between the town and DPH would have said. Normally, that's how you get money. Public health money comes in through a grant, and there's a contract that the town signs that says this money is used for tobacco prevention, or for opioid use, or for whatever the contract, for public health excellence grants, you know, whatever the contract says. The challenge with this money is that it's coming directly from the pharmaceutical companies. It's going from the pharmaceutical companies to the towns. So there's no, it has to be appropriated by the towns to be used for the purposes for which it was intended.
But it wouldn't be expended until, because you wouldn't want to have a negative ledger, but so it
Right.
still might mean that it needs to wait until it is certified as free cash to be
Correct.
given to, for instance,
Yeah.
the resource recovery.
But you want to
Center.
make sure that it's appropriated, which just means, you know, what appropriate means, you deposited the funds into the town budget. Now you have to appropriate those funds for a specific purpose. When the town builds its budget, it builds its budget based upon the money that it has and the line items in the budget. There's no line item in your budgets right now for opioid use. See what I'm saying? There's no line item there for this money that's come in. So without the town meeting appropriating it for a specific use, it's just part of the general fund.
And that article allows you to spend it mid-year.
And this
upon
article would be the vote of the legislative body, just like the vote of our Massachusetts legislature that designates that the money is already captured for opioid use. It can't be used for anything else. And it's not going to happen until, you know, it's certified as free cash. I mean, the money came in before towns, before local legislatures could designate what it was used for. It just came to the town.
So,
And
Cheryl,
I see Rich is on now too. So Rich, I think I described it the way it's meant, but do you want to go through why it has to be done in this fiscal year?
Yeah, right. Cheryl, I think you explained it correctly.
Oh, okay, you heard it. Okay.
I did. Yeah.
Okay.
I mean, I don't know if people are being told otherwise, but I think.
And the reason that we are stressing this is because this is what the Department of what DLS is suggesting. This is their guidance on how to capture this money so that it's used for opioid purposes, not for anything else.
And is DLS the same as DOR? And are they on the same page?
Yes, DOR and DLS are definitely on the same page. That's
I
why
ask
I
a-
sent that guidance document over to you, because it has the links to the memos that we use to create that document.
Oh,
In the
Let me ask
footnotes,
a
there are
question
the
about,
links. So I understand why your controller might be confused, because this isn't the way money usually comes in to a municipality.
okay, Cheryl,
But-
may I ask a question? May I ask
Sure,
a question? Since this process is going to go on for 10 years, if I'm correct, that we're going to be getting this money
Yeah.
over a period of 10 years, should we, in fact, and I don't know what it takes, but should we create a line in the budget?
yeah,
So
you should,
that-
yeah, and that you do that by creating the stabilization fund. You can create, and that is what some of those documents are. Once you do this initial, we just want to make sure we capture the FY 23 money, because it's already come in. And I think more of it's coming in too. I have to look at when the payments are, but because we just need to capture that for moving forward, you'll just create a stabilization fund and just put this money in to the stabilization fund, the opioid stabilization fund. And then you're not going to be,
You're
I'm sorry?
recommending that we do, you're recommending that we do create a stabilization fund.
Yeah,
Because-
for the following years.
Because
So-
some of the towns that I've talked to are like, we would just rather appropriate it instead of creating a whole new fund, but.
you
is it-
can
think
do
it's-
that.
So, yeah, I mean, it's personal preference, but the one good benefit to a stabilization fund is you don't have to spend it all in that,
That year.
in that year. You can spend it as you need it. Now, there's legislation, out there that might allow towns to create a revolving fund, which would be great. But I don't know if that's going to go anywhere.
We don't know if that's gonna, and it's still not gonna change the fact that you need to appropriate the money
Right.
every year.
Which would, right.
But it's
And-
gonna, I mean, if you've got a stabilization fund, that's gonna be a line item in the budget.
And we don't mean to be vague about when the money's coming in, but you have to understand it's kind of a moving target because there are lawsuits still going on that
Well,
could be
I can
settled.
just tell you, I was on the phone with the AG yesterday, and they've settled 5 more lawsuits against Walgreens, CVS, and Walmart, and a couple of others. So those are gonna, I mean, and actually your town controller should have received notice of that yesterday. And they need to sign off on, their individual agreements with these other defendants so that they can set it up so that more money is coming in. So, yeah, I mean, it's a moving target with this money that's coming in. And it's just the way it's coming in makes us have to jump through these hoops because it's got to get appropriated in order to be used for the purposes for which it was intended and which all the municipalities have signed off on.
I
Okay.
think what small towns are saying is the stabilization account seems a little too much, because if we're getting $1,000, we're
Yeah,
absolutely gonna spend
it
it
might,
in the
yeah.
year.
If you're getting $1,000, you might just want to appropriate it
Yeah, and the
and
other
not
thing,
create a fund.
yeah, the other thing is you would need, I think it's 2/3 vote first, to move money out of a stabilization fund rather than
Yeah,
majority.
yeah.
So
It's a
it may,
majority
if you're
to
only,
create
if you're
the
only,
fund.
yeah, if you're only getting that much, it, certainly it doesn't make sense to do it, but
And
obviously.
again, some of the smaller towns, my understanding is that they're pooling their money and putting it into a recovery collaborative that may already be in existence.
Yeah, that's what we're
doing.
proposing to do.
Yeah, and there's an easy, there's a memorandum of understanding that's out there that I'm not sure who created, but we have it, that it's a simple agreement between a town and whatever the recovery establishment is to just give the money to that. But again, it needs to be done through town meeting. Or through, actually, I think,
No.
Rich, you looked at that. It was one of the planning commissions.
Yeah, it was a planning commission to Rural Recovery Center and so
We have
so the
that.
town would appropriate I mean, I would assume the town appropriates money to the planning commission, and then the planning commission can, you know, transfer it
Makes an
over.
agreement with the town for how the money's gonna be spent.
Right.
No, we're not doing planning commission.
No, so I know what you're talking, that, yeah.
That's a separate,
they-
that's another strategy.
All right, great.
Does
For
that
those
make
are
sense?
confused- And for those that are confused, and go back and watch the meeting on CTSB later when it's posted.
I'm not just the public health nurse.
Thanks, Cheryl, Rich.
Does
Thank
that,
you.
does that make sense to everyone? I mean, we're
At the
happy
moment-
to talk to your controller if you're having, if there's issues, but I think once they see the guidance document and the citations and they go to the citations, I think they probably understand it more than any of us do.
Yeah, and they just wanna make sure that they're doing it right, you know,
Yeah.
and this is, like you said, an unconventional way of getting money, so.
It
And we
is.
have that guidance document. I mean, we.
Yeah, you do. And it's, if you need it quickly, it's on MAHB's website. You can just
Yeah,
download it.
it's in our packet.
Yeah. Ah, that's good.
Yeah. Yeah, I read that.
Thank you.
Thank you so much.
Thank you, Cheryl, as always.
You're entirely welcome. You caught me right before I was going out to buy my ingredients for my Super Bowl dinner.
Excellent. Lots of avocados.
You caught
Want to
me.
get in the way of that.
Philly
Thank
cheesesteak.
you. Thank you both.
Thanks a lot. Yeah.
Sure. Bye-bye.
Bye now.
Okay, I've lost my agenda. Oh, no, I'm writing on, here we go. I think that was the opioid settlement issue.
Yes.
We'll cross our fingers and hope that it will work. Are there member updates? You are at a raised elevation and it's bugging the heck out of me.
Well, raise
You're-
up your.
Never mind, go for it.
Knocked her down a peg. Been trying to do for years. So our special town meeting last night. Tuesday night voted to increase the number of board members for the Board of Health from 3 to 5. This is something that I, despite what people thought, have advocated for like 15 years. Because it really reduces the tension. We have one person who is feeling very manipulated because they always get put into the pivot vote position. I'm just reporting this absolutely honestly. It erupted with a vengeance on the last meeting. And it was very ugly. And it resulted in the canceling of a hearing for the public on some proposed regulations. And I don't know what the outcome of that is going to be. But we shall see. And one of the reasons I want to bring this up is that I think perhaps we're talking about supporting boards of health, which you guys have been fabulous with. Thank you so much. One of the public health excellence things that I think we need to look at is having Board of Health members be trained and have them get education, because one of our biggest problems is having people who honestly either do not understand what it is that they're doing or believe in the system.
Okay,
And
so
I'd like to put that out there for that. So
that's good.
I think it was a positive move, where we're gonna get 5 members to show up every month and do the work is beyond me, but
Nominate Linda Beckwith.
as she won't do it. But as the, agent, my point of view on this is that a lot of what I do needs to not be done by me. It needs to be done by members, and it needs to be done by members who are informed and who have an understanding of what it is that they're supposed to be
I think
doing.
that's part of a valuable discussion
So
that we
thank
can
you.
have on the goals.
And I'm.
Can I
not-
just- Can I just ask, what town was that went to 5?
Not Washington.
Oh, the big one,
It's like
okay.
2/3 of our freaking population.
It is a percentage of your population.
Do you want, as a collaborative, do you want us to set up a a Zoom program for all of your boards of health in your collaborative, and Cheryl and I will give you a couple of hour presentation on the duties and responsibilities.
Wow.
Absolutely.
Okay, we do that.
Yesterday.
We do it in 3 different locations every year. We're doing it again at the Delaney House, whatever town that's in, I forget right now, but that's the closest one to you. But I think that we need to reach out to these new board members and to some of the old board members who still have no idea what they're doing.
All of the members, and it does need to be by Zoom because these guys really need, and I use that generically, the members really need to be able to do it on their own time. Because they're not available during the days for these things.
Well, we can
Well, we
record
would do
it.
it. We would do an
Right, that's
evening.
why I said it's a
We would do an
recording.
evening program for you. We've done that for a couple of other groups, and
That's
we
a
can-
great suggestion, Mike.
Thank you.
Well, I got one very quick question as we wrap up. So if we get multiple board members in one town, what are the open meeting law issues with that, with the training?
Well, they're
Well, I
not
would do-
deliberating.
No, they have,
Generally speaking, you don't have to post something like that because it's a seminar, but I would think that where we're dealing with a small geographic region where you have a lot of issues that somebody's going to raise their hand, it's inevitable, and say, my Board of Health is confronted with, because that's what these programs bring out in people. So I would just for giggles, I would just post them.
Okay, we would
decide to
love
do-
that training, by the way.
Yeah,
Thank you.
great.
Great. So I have 2 things. One is, in your packet are the safe, proposed standards for everyone in, which includes management agent, inspectors, public health nurse, clerical staff, and then Board of Health member. And you'll see that they're proposing to have education be required for different levels. That is going through the legislature again. Remember that Governor Baker sent it back with comments and then the legislature never voted on it. So you'll be hearing more about that and maybe being asked to have some call to action. And then on that. So the second thing is that also with our vaccination program, we put together a draft public service announcement that we're gonna be distributing to the different towns, basically saying, starting February 21st, we're gonna have regular office hours at Tri-Town, as well as some Saturdays. And we're really hoping to capture some of the kids that are on break during that time. A lot of parents aren't working the same, so and we haven't quite gotten a flyer together, but once that comes together, I am gonna ask everybody to put that out there, and we're gonna try to get as many of those $75 gift cards out there and cover hopefully a population that has been difficult to reach. That is the 5 to 11-year-olds.
Okay,
So,
but it would be open to anyone.
Yes,
Mhm.
I just vaccinated a couple people. Last time they got a shot was in 2011.
Oh.
Yeah, so.
And this would be for any vaccine? I mean, flu
for the-
and
No,
COVID booster
COVID booster.
and then flu.
Okay,
And I will tell you, in the public service announcement, we're encouraging people to contact us to help, so we can help them figure out, like, to go to VIM, for instance, or, well, VIM, I said VIM, but CHP gives the primary doses and they give it to the babies, and so, you know, we can help facilitate, be like, we're not giving that, but here's when they're gonna be in Great Barrington, why don't you call and make an appointment? So instead of just leaving people to their own devices, we're hoping to be able to refer some to other programs that aren't filling that,
an effective handoff.
an effective handout, yeah. We just want people to be supported.
Good. Any other member updates? Okay. Do we have any citizens here? I don't think so. Anybody online that's a citizen? No. All right. Jane, upcoming training.
Oh, you know, the Berkshire County Boards of Health Association has a nice list that they've been sending out of all the upcoming trainings, and so I don't have anything additional to that, so I think everybody here probably receives that email, so.
Great. Upcoming meeting. We talked about these two.
The one question that I have is if we're meeting the 17th and we might be meeting the next week, is everyone okay, or a couple weeks after, is everyone okay to having more meetings during this time?
Well, we have March tenth is
Our regular.
our regular meeting, and then the 17th. I think 3 meetings in 1 month is a lot.
Do we want to cancel the March 10 meeting and just deal with the 17th first and then try to figure out a reconvening after that?
Yeah, so what would
And
that be?
reconvene the week
April?
after, maybe.
Let's just set everything.
Be April 14th, which would be 4 weeks out from the capacity meeting.
Right, but if we canceled the 10th and met the week after,
Why would?
If you cancel the
discussion,
10th, which is our regular meeting, go to the 17th for that meeting, and then have what would have been our extra meeting the week after, I don't know.
I mean, I don't think, I mean, Jane, correct me if I'm wrong, the capacity might probably is not gonna come out till July 1, right? You know, when the DPH commits to the capacity money, it's probably not gonna happen until July, right? The dollars, I don't know. I don't know either.
But I think that more than that, we need to just, we're gonna hear
Yeah.
what the state is saying, and while it's too much time goes by, since we're not meeting right after that, and unless we wanna meet right after that to talk about it.
That's what Ellie said.
Right, that's what I'm saying, is if we cancel the 10th, which is our regular meeting, we meet on the 17th, which is our special meeting, and then if we met on the 24th, we can pick up whatever we needed to talk about from the 17th, and then go to our regular meeting in April.
Yeah,
Spreads it out a little bit.
I won't be here. From the 22nd to the 29th.
I mean, my suggestion is we add a column in our 17th agenda on tentative future dates, and we can decide after that meeting if it's really imperative that we need to meet.
That's a good point.
But do we want to cancel the February 10th meeting? though,
March
or
10th.
10th?
I think that's what I'm hearing.
Okay, but then how do we add on to the 17th?
We're gonna
That's
discuss it at that 17th meeting, Ellie, after that presentation. We're gonna have to have a
after,
discussion.
okay, so we're gonna have to post a meet,
We're gonna post the 17th with an agenda with tentative
Including, right.
dates, and then after that presentation, we'll be
We'll have
at a
some time.
meeting, we'll have to decide if we want to do that.
How long, I forget, how long is the DPH meeting?
Hour and a half,
Hour and a half, so we'll be here for.
lunch, 10 to 11:30.
Well,
And
and
it's all virtual, by the
meeting
way.
afterwards,
Yeah.
right?
So, okay.
Let me share a little intelligence here on the capacity assessment. They're
Ooh.
going to meet with all of the groups, and then they will be writing a final report, which they are internally targeting having finished in May for a statewide report, and that it will then have to be signed off on by the secretary, which means that it goes up the chain, which means, as we all know, once it leaves DPH and goes up the chain, it could be a week, could be a month, God knows. There's no way of knowing how long that's going to take, especially with the new administration. But the final report won't be out probably until May at the earliest. June is the most likely, and then money will follow after that. Just so you all
Mike,
know.
what have other public health excellent grants have you experienced during those meetings? Have they actually started yet? The
No,
first
not
round?
yet. Not yet. Not yet. And I'll let you know, I'll give you some idea hopefully ahead of your meeting, what the experiences are being. I'm not
Okay,
going
so
to all, we were originally, Cheryl and I were originally going to go to all of them, and they asked us if we would not go to all of them. If you want us there, you can ask for us. If not, you don't have to. But they're going to talk about the services that we bring, and then tell you to contact us afterwards. And my idea is that that's stupid, because I'd rather hear what you guys are being told by them, so that when you call me, you could say, remember when they said such and such, what do we do? Instead of you taking me back through the whole meeting 50 times over, because we're dealing with all 50 groups.
I'd like to call for a motion to have them.
I'd like to invite you.
Yeah. We'll let you know, Mike, but our sense is
Okay.
we probably would like you there.
All right, just let me know if you do or not. No, I'll talk to you.
Okay.
Do you have
Do we need
to
a vote?
Uh,
I don't think so.
You don't? Okay.
Should we just tell him now that
Yes, we'd like.
Can
to
I
be there.
plan on coming at the, our 17th?
So I'll make a motion to the collaborative to request Mike attend our capacity assessment meeting.
And or. Your name,
Cheryl.
yeah,
MAHB.
Second,
okay, any discussion on the motion to include them in our assessment meeting? All those in favor?
I,
Opposed?
Here we go.
Okay,
What time is your meeting on the 17th? Do you know?
10
10.
o'clock.
Okay, good.
so if I understand correctly, we've canceled the meeting on the 10th.
that is correct.
And we will have a meeting on the 17th, which will be 2 hours.
Hour and a half technically,
I think
yeah.
it will end up being 2 hours if we want to
Good.
plan some time
Yeah.
to schedule our next meeting and
Right.
debrief. I mentioned we'll have thoughts.
Right, right.
I'll book the room for 10 to 12:15. Okay, that gives us 40 minutes after.
And that's the good question, like, we talked about having it fully remote, with this setup, would we want to convene, or like, how's that gonna work?
So DPH is hosting this meeting. It's not our meeting
Oh,
that we
so
have
when they get
hybrid.
in,
So I think it's gonna be fully remote.
Okay.
Because we're not hosting it, DPH is hosting it and it's fully virtual.
right,
We'll post it and stuff, but I think it's.
But could we all come down here?
If you're gonna have a meeting afterwards.
If you're gonna have a meeting afterwards, if we come down here, do we all have to sign in or individually?
Why don't
They
we
can
just
work
stick
that out
with
with you. They can do that. They can make your Zoom node one of their invitees for the they use that horrible program, that whatever that Microsoft program is, Teams.
Teams?
Oh,
Teams,
yeah.
yeah, it is.
But you can go in as a Zoom group into Teams, from what I understand. Teams, not Teams, Teams.
I just think fully virtual is easier for having a member from every town be required to be at that meeting. I just think from a navigation perspective, it will be a lot easier for us.
I think the one thing about having everyone virtual is that people can hear. I don't know how this experience has been. Steve, can you hear better this one than you normally can? Or is it the same, Steve?
I'm sorry, I can't hear you. I can hear you, but it's well scrambled.
Okay,
Oh.
so if
Here's your
everyone
answer.
had it virtual. Yeah.
All right, so we stay virtual, we stay home, do the meeting, and it's a 2 hour. And you have to allow for 2 hours at home.
Fine.
okay, so then we'll have to figure out if we're gonna meet, which we may be able to do quickly at the end of the meeting, before they turn us off. Okay. Any other issues to bring up? No? Then I would entertain a motion to adjourn.
A second.
Oh, I made the motion.
So moved.
Rebecca made the motion.
You seconded it.
I seconded, well,
Great. I don't allow discussion on the motion, so, all those in favor?
Aye.
Anybody
Thanks,
there?
Mike.
not?
Thanks, Steve.
Thank you, Mike.
All right, we'll see
Thanks,
you all.
guys.
Bye-bye.